and sensory integration. This is a facilitation technique overview. Sensory stimulation in therapeutic recreation is crucial for enhancing mental, emotional, and physical health, particularly for individuals with cognitive impairments. Techniques are tailored to clients' needs, environment, and cognitive levels. Sensory experiences may include visual, taste, touch, smell, and auditory. Combining multiple senses can create a more immersive experience. Individualization is key, using familiar or meaningful objects, songs, and materials to evoke positive memories and emotional responses. Therapeutic tools like weighted blankets may also be incorporated. Regular evaluation of sensory treatments is essential, with adjustments made to optimize outcomes, such as improving emotional and cognitive performance and reducing anxiety. The approach is supported by evidence-based practices, ensuring safety and effectiveness with ongoing modifications based on client feedback. Overall, this technique is highly personalized, aiming to provide a meaningful and therapeutic experience that enhances overall well-being, especially for those with cognitive impairments. This rationale highlights the importance of incorporating sensory stimulation into therapeutic leisure, especially for individuals with dementia and ASD. This chapter justifies this approach by emphasizing its cognitive, emotional, and therapeutic benefits, as well as its role in personalizing care and preventing further decline. Sensory stimulation is seen as essential for those unable to participate in traditional recreational activities due to cognitive impairments, as it helps maintain emotional well-being and connections with others. The chapter argues that sensory stimulation should be an active therapy, engaging multiple senses to have a lasting impact on behavior, mood, and cognitive function. It also stresses the importance of customizing sensory experiences to individual needs, which can reduce anxiety and restlessness in people with dementia. The chapter is supported by research demonstrating the effectiveness of sensory stimulation in improving the quality of life and cognitive function for those with cognitive impairments. It advocates for a holistic approach to care that includes sensory stimulation as a key component in enhancing overall health well-being.
Evidence-based techniques. Studies in sensory stimulation allow recreational therapists to ensure that facilitation of treatment plans and intervention strategies is evidence-based. The effectiveness of sensory stimulation in recreational therapy can be examined across individuals with dementia, autism spectrum disorder, and pain management. We will focus on examining the data and evidence of a diverse range of clinical trials. Evidence-based techniques in individuals with dementia. Butner conducted a 30-week study with 66 nursing home residents reporting a high degree of wandering and general agitation due to boredom prior to the intervention. During the intervention, agitation and boredom levels significantly and dramatically declined. This can be attributed to the 30 handmade sensory items such as vests, games, flower arrangements, carts, and fishing boxes, created to provide the residents with purposeful activities and decrease agitated behavior. These sensory items allowed individuals to decrease in wandering, restlessness, and isolation. Furthermore, Livingston reported that snoozling reduced disruptive behavior immediately after a 60-minute session in patients with dementia. Contributing to this, Roy examined the impact of snoozling on the well-being of 50 dementia patients. Studies showed that the cognitive function had an increased activity in areas such as speech, social connections, awareness of environment, and initiation of daily tasks. Overall, the increase in cognitive function led to decreased boredom and more enjoyment in their environment. Animal-assisted therapy in dementia patients. This study requires patients to pet, brush, feed, and talk to therapy dogs within a short time frame. In this study, AAT is an effective sensory stimulation intervention in increased socialization and decreased agitated behavior. New studies found that AAT reduced aggressive behavior, delusions, and depression. Comparable to other studies, agitation and aggression decrease. Patients further identified an increase in self-esteem and feeling safe in their environment. Evidence highlights an increase in positive behavior such as feeling calm, increased communication, reduced anxiety, and loneliness. Results indicate a slight improvement in short-term memory and information recall. Aromatherapy in dementia care. In this review, On 11 randomized trials involving 298 patients, research indicated that in 60% of cases, aromatherapy reduced agitated behavior. Smallwood examined further a decrease in excessive motor behavior when engaging in aromatherapy in massages. Willander and Larson, another study, found that odor cues such as whiskey, violet, red wine, etc., could stimulate autobiographical memories of early childhood. Evidence in sensory stimulation in autism spectrum disorder. Strickland analyzed the effects of virtual reality among youth with autism in 2 case studies. It was first introduced to understand ASD further and assist with new ways of responding, learning, and creating meaningful experiences. Evidence from this study indicate a successful engagement desired behavior and interacted appropriately by tracking and identifying objects. A literature review by Baranick analyzed the effects on touch pressure on behavior in children with autism. Touch pressure is applied via therapeutic touch, such as massages and joint compressions, or an apparatus through hug machines, pressure garments, and weighted vests. Evidence in this study suggests that touch pressure resulted in reducing stereotypical behavior by 50% and had a calming effect in 80% of participants. Touch aversion, off-task behavior, orienting to sound, and stereotypes such as body rocking, self-biting, headbanging, and nail biting demonstrated positive changes post-treatment. Recent studies show that deep touch, rhythmic application of touch, and vestibular sensation has a calming and organizing effect on individuals with autism that promoted self-regulation. Deep touch techniques showed a lower high arousal rate, such as agitation, hyperactivity, and self-stimulating behaviors. Next, Ferrari and Harris analyzed the sensory stimulation of vibration, music, and strobe lights on 4 patients with autism. Results indicated that sensory stimulation can be used as a positive reinforcer to increase desired behaviors in simple bar pressing responses for future treatment plans. Adding to this, evidence indicates that sensory stimuli can improve an individual's attention and response to simple tasks, as well as a significant increase in motor movement and neurodevelopmental skills when using music-based interventions. Sensory stimulation in pain management. Schofield and Davies conducted a study comparing 2 control groups in pain management. One control group received 6 hours of relaxation instruction, and the treatment group received 6 hours in a multi-sensory snoozling environment. Evidence shows that the treatment group reported improvement in pain, disability, self-efficacy, and an overall better quality of sleep. Another study in severe brain injury showed that there was an increase in cognitive outcome while decreasing agitation in 15 patients with this brain injury, once exposed to 10 snoozling sessions. A qualitative study by Hwack analyzed the effects of a snoozling environment for women during the birthing experiences. 16 women engaged with fish tanks, relaxation musics, and aromatherapy tailored to their interests. Across all women, the sensory stimulation resulted in an increase in comfortability, environmental control, relaxation, and safety. They further identified a decrease in anxiety during the birthing experiences. However, these studies show that the overall efficacy and evidence of sensory stimulation techniques is limited and highlights the need for further research. This is a result of the studies having a small sample size and limited evidence of large-scale effectiveness of interventions. As RTs, these findings suggest multimodal sensory interventions may be most effective when tailoring the treatment plan to the client's desired goals and needs in order to achieve greater health outcomes. Authors of sensory stimulation and sensory integration. A sensory integration approach can be attributed to authors such as Jean Ayres. Her theory and framework assisted in the understanding, development, and research of sensory integration techniques across fields of occupational therapy and physiotherapy. This technique develops a framework of understanding cognitive and sensory processes and their effect on learning, behavior, and motor skills. However, Butner and colleagues have applied sensory stimulation techniques within recreational therapy. Furthermore, Patterson contributed to utilizing multisensory environment and snoozling in recreational therapy. The author concludes that sensory integration in individuals with developmental disabilities can further address their functional and leisure needs. Utilizing the leisure ability model as a theoretical basis, snoozling for individuals with intellectual disabilities can initiate behavioral changes in the functional intervention stage of the model. The recreational participation stage of the model is highlighted by the enjoyable nature of sensory stimulation activities. These authors identify sensory stimulation interventions grounded in theory and evidence-based practices to create meaningful experiences tailored to the client's needs and overall better quality of life.
Theoretical foundations. The theoretical foundations of the usage of sensory stimulation programs have been studied by a range of authors who have completed their research studies on a range of client groups. These groups include elderly people suffering from advanced dementia, people with developmental disabilities, people with traumatic brain injuries, people with schizophrenia, and people living with HIV/AIDS, and people in pain. The core reasons behind this research was to identify the usefulness of sensory stimulation and integration for people who receive therapeutic recreation services that have cognitive and physiological impairments that significantly limit their ability to participate in everyday events and activities. These impairments include trouble processing textures, sounds, colors, and tastes. By using multisensory stimulation sessions, individuals with moderate to severe dementia were reported to be happier, more alert, and less bored or inactive than they had been previously, according to the research by Baker. It was also noted that patients also talked more spontaneously and did more for their own initiative, as well as being able to relate better to others. Baronet conducted research into the responses to sensory stimuli and motor patterns of young children with autism. Numerous sensory and motor therapies, especially those focusing on sensory integration, have their theoretical foundation in empirical research demonstrating that children diagnosed with autism do in fact exhibit significant abnormalities in a range of sensory processing and motor skills. The research conducted through these studies of different client groups has laid the groundwork for sensory stimulation and integration by highlighting the benefits and disadvantages while noting what improvements can be made in future studies. This has allowed for the knowledge of sensory stimulation and integration to be improved and broadened so that service providers can create adequate programs for their clients. Target populations. According to Stumbo and Wardlaw, anyone can benefit from sensory stimulation for whatever reason, whether that be to invoke memories through smell or listening to meditative music to encourage feelings of calmness. While anyone can benefit from this technique, the intended populations for sensory stimulation are individuals with dementia, individuals with autism spectrum disorders, individuals with pain, as well as individuals with mental and cognitive health issues. Through the numerous research that Stumbo and Wardlaw have cited, interest in the advantages of sensory stimulation of older adults, and particularly those who have dementia, has grown. Enhanced socialization, sharper focus, better self-perception, and heightened awareness are some of the advantages. Creating a setting that gradually engages all of the senses has been proved to have several benefits. Various techniques have been identified, such as the use of strobe lights, music, and vibrations to help with food and social reinforcement. There is also evidence indicating the positive effects of virtual reality sensory stimulation intervention on youth with autism who are struggling to identify and perform safe online behaviors through the research of Strickland. The participants involved in the intervention demonstrated appropriate virtual behavior by being able to track and identify objects. When examining the research available to identify how sensory stimulation is beneficial for people experiencing pain, in an Australian study conducted by Hawke, midwives and nurses investigated the effects of providing women with a snoozling environment while they were giving birth. They provided a multi-sensory environment during childbirth and involved 16 women. A wheel projection that rotates to display all patterns and fiber optic lights with slowly changing colors was among the environment's gentle textures and hues, in addition to a fish tank, soothing music, and the women's preferred aromatherapy. 6 themes emerged from the women's experiences, according to the investigators. These included diversion, relaxation, comfort, environmental control, selection of complementary therapies, and safety in a setting reminiscent of home. Strengths and weaknesses. All interventions used within therapeutic recreation services have their own strengths and weaknesses. As a service provider, it is important to research and assess the compatibility of an intervention for a specific client. Sensory stimulation and integration is used widely among therapeutic recreation service providers and has its own strengths and weaknesses. Some of these strengths include sensory stimulation helps to build nerve connections in the brain and encourage the development of language and motor skills. Sensory stimulation activities can help individuals improve their social skills, coordination, and fine and gross motor skills. Increase concentration and focused attention, develop senses of hearing, sight, smell, touch, and taste, heightens awareness and improves alertness, promotes cognitive development by increasing brain function, promotes social interactions, mental and physical relaxation, and prompts calmness and lower aggressive behaviors. While there are many strengths to sensory stimulation, there are also weaknesses when facilitating this technique. These include sensory stimulation has the ability to overload an individual with stimuli, which has the potential to induce symptoms of anxiety, discomfort, and fear. With prolonged and high use of sensory stimulation, the potential of creating dependence on sensory input can keep the client from developing functional independence. One weakness in terms of research is that while some individuals have reacted favorably to sensory stimulation, other client groups, such as those with dementia and traumatic brain injuries who are excellent candidates for these programs, do not have as much research supporting their advantages as some of the other optimal client groups. In a systematic review for the Cochrane Library, Lombardi discovered no scientific evidence to support or disprove multisensory programs for people with traumatic brain injuries who are in comas or vegetative states. The similar conclusion was reached by Chung and Lei regarding the paucity of scientific evidence in favor of multisensory stimulation programs like snoozling for dementia patients. The use of sensory stimulation can be a significant financial investment as well as time investment. Clients may struggle to keep up with the upkeep of sensory stimulation therapy. Thank you for listening.
So